As my husband wasn't allowed into the radiotherapy room, I had to manage the undressing myself, which was very difficult because I had the fear that I might accidentally see the site, or also because of the pain I had in my arm and just generally I was achy. But I had help from the nurses that were in the radiotherapy room. So before the radiotherapy started, I was already marked with a permanent ink on my chest to assist the radiographer where the radiotherapy should be hitting. So I have like 1, 2, about 4 dots of permanent ink which were injected into with a needle on my chest, and it's quite a big area. It was quite a big area that had to be covered. So every time I went for the radiotherapy session, they would align the radiotherapy machine with the dots that had been placed on my chest. I would be lying on the machine bed for about 20 minutes and getting radiotherapy or radiation for those 20 minutes. And radiation is quite a big thing. Your skin is just getting burnt for 20 minutes every day for 3 weeks. During the radiotherapy sessions, I was getting exhausted. There was a lot of fatigue, and I would feel more weaker as the time went on. And my skin during that time started to turn a bit red. It started turning a bit darker, like a brownish, and then it changed to a slightly red. I then started using my aloe vera moisturizer on the skin to help me because there was a lot of burning sensation. It was stinging, but not so much yet. But after 3 weeks of sessions and further 2 weeks after the radiotherapy, I then started to have the full side effects of the radiotherapy. My skin had turned completely red, and there I was prescribed a cream, hydrocortisone, to just help with the burning sensation and the redness. Then the skin started to peeling off, as if when you get dried clusters on the skin, it started to just peel off, firstly just around the edges, then around the underarm and slightly side of the chest, this area. That's where the worst problem started. It was getting wet. It was just oozing with liquid, and there was this very bad smell. I felt dirty. I just felt disgusting within myself because the smell was just so bad, as if I've not had a bath for weeks. And it was just within that area. I never actually wanted to see, but that was the first time I actually managed to see myself. So that was in February when I finally managed to look at myself, because of the pain that I was in, or because the worst had happened to the skin, which I saw was more worse than having that scar from the mastectomy on my chest. My skin was just, when the skin is burnt and it starts to peel off, you see that raw skin or raw tissue. That's what I was seeing. It was painful. I went to the GP. GP referred me back to my Macmillan nurse, and the Macmillan nurse prescribed me some fish net plasters to put on, which helped with the healing, and provided me with a Flamazine cream to also use. And after weeks of using the cream and the fish net plasters, it really helped with getting my skin back to a bit normality, not fully normal, but to get rid of those burned skin. So my skin took a bit of few months to heal. It was hard to wear any clothes, so I would usually be just at home, walking around in a vest, which was very loose, so sometimes wearing my husband's t-shirt or his vest, because I couldn't tolerate any touch of any fabric on the skin. So after my skin had healed from the radiotherapy, I was referred to the orthotics clinic, which provide a prosthetic. I always can never say that word. I was provided with a prosthetic. So it's a fake breast made of like a gel or silicone to wear with a mastectomy bra. The orthotics clinic also sells bras. They start from £20 each. You don't get the bra for free, but you get a prosthetic free, which comes with a 2 years guarantee. And if it gets damaged within the 2 years, they can replace it free of charge for you. So I had one prosthetic which I've been using once I was comfortable to start wearing a bra again, and I was able to tolerate pressure around my waist. The prosthetic was is according to my measurements that were taken by the orthotics clinic. So they actually invite you into the clinic and they measure you and they try to match match your prosthetic with the other breast that you have. So that's what they did in my case.